All right, cancer. I don't think this is like 14 pages, so it's going to take us a while. And I just feel like it's crazy that we're doing all this work for like anywhere from 5 to 10 questions on the exam tops. But you really have to have like a fundamental understanding of whatever this is before you can really answer any question. But it's a lot of work in a short time frame. But that's just like me going on my usual rant. Before I start, okay. So, first things first, what is cancer? And as you probably know, cancer is rapidly reproducing cells. Okay? So when I say rapidly reproducing cells, this could literally mean any cell, as long as it is rapidly reproducing, it is cancer. Okay? And I don't just mean cells that just grow fast. I mean cells that are growing at an abnormally fast rate. So, and like I said, it could be any cell. And this is why you see multiple different types of cancers, right? You can see brain cancer, lung cancer, liver cancer, kidneys, cancers in your kidneys. Like anything or any cell that grows really fast is going to give cancer. Okay, and so most of the treatment that you have towards cancer, particularly non-specific chemo, is going to target these rapidly reproducing cells. And a lot of times, because this chemo is non-specific, we're also going to see it targeting cells that just grow really fast, right? So this could be your hair, your nails, your skin cells, right? Your epithelial cells on your skin. That's why when you see people with chemo or people who are undergoing chemotherapy, they end up losing their hair, their nails become more brittle, they have skin issues. So the reason for this is because that chemo, right, this non-specific chemo is targeting just any cell that rapidly reproduces. Also, sperm cells and germ cells are there too. That's why sometimes people with cancer are like, what's the word for it? Infertile, impotent. I don't know, but you know what I'm trying to say. Okay, so another thing I want to say is that cancers are not tumors. Okay, it's very easy for you to associate them together. Most times, a cancer will present as a tumor, and if you have a tumor, it will be because of a cancer. But it's important to know that there's like these intricacies to them, right? So you don't see a cancer and immediately think that, oh, you don't hear cancer and immediately think, oh, it's tumors, right? And you don't hear tumors and immediately think it's cancer, right? And so what are the main differences that are going to help you remember that? Well, first off, cancer is rapidly reproducing cells, right? Any abnormal growth resulting from uncontrolled proliferation, and this is the important part here, uncontrolled proliferation, is referred to as a neoplasm. This is cancer. If it is controlled, we're going to see things like your skin cells, your nail cells, your hair, your sperm cells, your egg cells. Like those are controlled, rapidly controlled proliferation. This is different from uncontrolled proliferation, and that is like a very key distinction in what differentiates cancer from the rest of your body or from the rest of your diseases, right? And then when you have this uncontrolled proliferation, we refer to this as a neoplasm. Okay, and let's move on to tumors. Tumors is like a broad term for a mass of new cells. This is including both benign or malignant growth. So benign growth basically means you have an abnormal growth, yes, but it's benign. Like it doesn't do anything. It's just there. Or like it's not harming anybody and it's not invasive. It's abnormal, but it's there. And then malignant is pretty much the opposite. So it's doing bad stuff. It is invading into your other tissues. It is metastasizing to places it should not be metastasizing to, your brain, your bones, your lungs, your liver. It is causing a whole bunch of problems in your body. That is malignant growth. Okay, so here I have this statement that says all cancers are tumors, but not all tumors are cancer. And I had made this like note before I Well, I made this note yesterday to help me like really put it into perspective. But the thing is, this is actually wrong, and I'll explain why. Right. So from what I just said, cancer is an abnormal growth resulting from uncontrolled proliferation, and a tumor is a mass of new cells. It's usually a clump. Right. So you can feel a tumor. So a lot of times when you really reason it out, it makes sense, right? Like a lot of times cancer, right, which is uncontrolled proliferation, is going to cause like a bump, or you can feel it, like there's going to be some kind of like protruding feeling from like wherever the cancer is. But what if you have cancer of the blood? Right, so you have rapidly reproducing red blood cells or rapidly reproducing white blood cells. You're not necessarily going to see a tumor, but because it's uncontrolled proliferation, it's still cancer. So cancers and tumors are very different. Not all cancers are tumors, and not all tumors are cancers. So this phrase is actually wrong. So it should be, not all cancers are tumors, and not all tumors are cancer. Because a tumor is just a growth, right? If you see a bump on your body, that's a tumor. It's a growth of cells. It could be benign, right? Like it could mean nothing, like it's just there, or it could be malignant, which, and if it is malignant, then it's cancer, right? So a lot of times cancers will present as malignant tumors, but this isn't all the time. If you have cancer of the blood, it's not going to be a tumor, it's just going to be cancer, right? If you have just one cancer cell that's located somewhere in your body, right, and it's just causing so much trouble, but it's literally just one cell and it's not big enough to make like a significant indentation on your skin, then that's not a tumor, it's just cancer. So that's like a key distinction. I would say that you should keep at the back of your mind. Okay, so the key takeaway from everything I just said is that if something is benign, it's not cancer. If this growth, if this tumor is not affecting you, it's not metastasizing, it's not invasive, and it's poorly differentiated, then it is not cancer. However, if it is, right, if it is malignant, so if it is metastasizing, and metastasizing basically means it's leaving from one, like, okay, for example, if you had a cancer that started out in your liver and it moved to your brain, that would be an example of metastasis. So it's basically moving from one, its original organ or its original site of development to multiple different sites in the body. That's metastasis. Okay? So I've been talking a lot about things being benign versus things being malignant, but what does that actually mean? Okay, so benign, for something to be benign, you need to have like a certain amount of qualities, and I'm going to talk about them. The first thing is that it grows slowly, right? It grows really slowly. So you could have, say you noticed a bump on your skin that was like 1 centimeter, and then 20, 30 years later, you notice that now it's 1.2 centimeters. That's not that big of a difference, right? So you can tell by the way it's growing that it's not causing any problems. Like it's, sure, it's not supposed to be there because it's abnormal, but it's not doing anything bad. It's just there. So it's growing slowly is like a really good example of what a benign tumor or a benign cell would do. The next thing is that it has a well-designed capsule. This basically means that the tumor is enclosed inside a distinct fibrous or connective tissue. And I like to think of the fibrous connective tissue as a jail cell, right? Think of the tumor as a criminal. If this criminal was locked up in jail, they wouldn't be able to do anything. They just be in jail. That's kind of why it's benign, because it's locked up inside this distinct fibrous connective tissue jail, and it can't get out to do anything, right? So it's stuck in there and it's not harming anybody. So it's a benign, it's a quality of benign cancers, benign cells, not benign cancer, my bad, of benign cells. The next thing is that it's non-invasive. And non-invasive basically means, think about it, like it doesn't invade spaces, right? So if you have a roommate and that roommate never enters your room, she doesn't use your toothbrush, she doesn't invade your personal space, she is a non-invasive roommate, right? She's not trying to poke her nose where it doesn't belong. And that's what this Cancer is. It's, or I keep saying Cancer, I mean cell, bro. Because this lecture is literally about Cancer, so I keep saying Cancer. But basically, yeah, it doesn't spread to other sides, to other parts of the body. It just stays where it is. And I have this little thing here that's like, let me just stay here and mind my benign ass business because I thought it was funny. Yeah, okay, that's non-invasive. And then the next thing is well differentiated. So this means that the cell looks similar to normal mature cell tissues. So this is our benign cell, and this is the original. See how like they're kind of similar, like they're literally the same cell but like a little different. So it is kind of, at first to me it was kind of confusing, because if something is well differentiated, shouldn't they look different? Well, actually, so in this scenario, when you say something is differentiated, right, to differentiate is, I think it's used in cell division. So when a cell differentiates completely, it's kind of like it produces a brand new copy of itself, like it divides, right? And if it divides well, so the cell is going to be similar to its parent cell. That's that's good differentiation. So cancer cells are well differentiated in the sense that they are very genetically similar to the parent cell they came from. Okay, that's what a benign cell is like. And if I say cancer cell and I'm talking about this cell in particular, you should know I'm talking about benign cells. I'm just like, my brain is fried right now. Okay. Next, we have low mitotic index. So this one's kind of, it sounds like a lot, but it's really just, the words they use are just really big. It doesn't mean anything. Mitotic is, think of mitosis, right, which is cell division. And a low mitotic index means they have a relatively small amount of cells dividing at the time of examination, right? So say you come in and you think you have cancer because you've got like this weird looking lump on on your breast because you're a girl, or you're a guy because guys can have breast cancer too. I mean, no. So you have this like weird looking lump on your breast, and then you go into the doctor and they like get a biopsy and look at that lump under a microscope or in the labs, and they realize that yes, you do have an abnormal cell that is reproducing, but it is reproducing very slowly. So say at the beginning of the year you had like one abnormal cell, and then at the end of the year you had like two abnormal cells. You see what I mean? That's like a very low mitotic index. And then the third one is does not metastasize, which is kind of similar to non-invasive, but the difference is that if something is invasive, it means that it's going into nearby tissue. If I'm invasive, it means I'm going into, okay, back to that roommate analogy, right? An invasive roommate is a roommate who will leave like her room and enter your room in the same house. A roommate who metastasizes is a roommate who will leave the house and go to another house that's like down the street across in the next neighborhood. Okay, so metastasis means you're going to a very distant side of the body, whereas invasive means you're literally going next door, right? Or you're literally just looking around in the area beside you. So that's like the big difference between those two. Okay, now let's move on to what makes a cell malignant. And it's literally the opposite of everything I've just said. Okay, so they have rapid proliferation. They are growing extremely fast. And again, what is cancer? Cancer is rapidly reproducing cells. So malignant cells are cancer, or rather malignant tumors are cancers. And if you ever hear something being malignant, you should just picture it and think about it as cancer, unless indicated otherwise. Okay, then we have they're not encapsulated, right? So they don't have a jail cell. They're free. They're like a criminal who's free, roaming the streets, doing whatever they want. And then we have invasive. right? So it's like that roommate analogy. So it's running into your room, it's going into your bathroom, using your toothbrush, wearing your clothes, like it's invasive. Then we have it's poorly differentiated. Okay, and this is where what I was saying comes into play, because with benign cells, they are well differentiated, which means that they are very similar to their parent cell or to normal cell tissues of that nature. So, say this was a endothelial cell, for example. This is what a normal endothelial cell looks like. This is what the benign cell looks like. So it's very, very similar. They're very similar to each other. Whereas in here, this is the normal cell, right? This is the cancer or the malignant cell. Remember, they mean the same thing. Okay? So see how different they are? This is because they are poorly differentiated. So I don't really have a mnemonic to remember that, because I feel like it's a pretty straightforward concept. Yeah, like poorly differentiated means that you can you like it is so easy to tell them apart. Like it's very easy to tell them apart. Like it's poorly done. This like the rate at which it divided was like clearly not good, because this cell looks nothing like its father cell or its mother cell or the parent cell or just a normal version of itself, right? Okay, so there's two key terms that I want you to know when you're thinking about poor differentiation in terms of malignancy. Okay, so first things first, we have something known as anaplasia, which is the loss of the ability to differentiate. So the cell stays in a stem-like state. Okay, what does this mean? So first you have to think of stem cells. Stem cells are like blank canvases of the body. They can become anything that the body needs them to be. So a stem cell could be a skin cell, it could be a muscle cell, it could be a smooth muscle cell, a cardiac cell, a kidney cell. Like a stem cell is literally a blank canvas that the body paints on to fit its needs. All right. So if you have a cancer that's like a stem cell, it means that they can do whatever they want. Like they're not confined to a specific thing. Okay. Also, because stem cells are so young, they have a lot of time to grow and to reproduce. So think of cancer in that sense too, that because cancers have anaplasia, again, which is this thing. Ooh, that's like a really big highlighter. They don't have the ability to differentiate well with their parent cells or with the other cells, similar cells, right? That's why they look so different, because they're poorly differentiated. Another term I'd like you to keep in mind is that some cancers can be pleomorphic. Now, what does morphic means? Morphing means to change, right? Like to morph into something else. Pleo, I like to think of it as being pliable. So pleomorphic means like to when a cell varies in shape and size. So if you were to use this in a sentence, you would say, "Oh, I see an anaplastic cell with signs of pleomorphism." That's basically saying, "Oh, I see a cell that is unable to differentiate. So I see a cell that looks different from every other cell, and it's also like the other types of this cell that I've seen are also different shapes and sizes. So it's not, what's the word? It's not, it's not consistent, right? So it's like this isn't just the only cancer you see. The other cancer could look like this. So see how like they're very different cells? That's how sometimes cancer can be pleomorphic. That's what that means. Okay. I already kind of talked about this. Like, again, a high mitotic index means it's rapidly reproducing at the time of examination, whereas metastasis is the spread of cancer or a malignant cell from its original site to a distant place, right? So from your lungs to your brain, that's metastasis. From your liver to your brain, that's metastasis. From your liver to your lungs, that's metastasis. Okay? Next up, we have, okay, so let's do a quick recap since I have it written here. A benign growth or a benign tumor will slow down growth. It is encapsulated. It is non-invasive. It is well differentiated. It has a low mitotic index, and it has metastasis. Whereas a malignant cell has rapid growth, non-encapsulated cells, invasive cells, poorly differentiated, which means you can very much tell them apart. It's very easy to tell them apart. So whoever did the dividing did a poor job, because you can easily see which one is the original and which one's the fake one, because it's poorly differentiated. Then we have something called a high mitotic index, which means that there's multiple amounts of cells dividing at the time of measurement. And then lastly, we have metastasis, which for malignant is, I guess it's the same thing as benign.